Hi, my name is Nancy Talam. I'm going to present to you my presentation regarding my PCOT in partial fulfillment of nursing 570 evidence-based practice, spring of 2019, Dr. Kathy Coram, Colorado State University, Pueblo, and it's April 25th, 2019. My PCOT. Does using a pressure relieving mattress in geriatric long-term care residents who are at risk for impaired skin integrity compared to not using air mattress impact the development of pressure ulcer at the end of 3 months? Pressure ulcer, which is P, require pressure relieving mattress, is an I, among geriatric long-term care residents who are at risk for impaired integrity compared to not using pressure relieving mattress. C, to prevent the development of pressure ulcer or at the end of 3 months, which is the time. Pressure ulcers are very prevalent in most of the facilities, and it results to high mortality and financial cost. Risk factors include serious illness, being older with multiple comorbidities, neurological impairment, malnutrition, immobility, and incontinence. In the United States, 2.5 million people acquire pressure ulcers. 0.4 to 38% is in the acute care, like in the hospital. 0 to 17% is home care, and 2 to 24% in long-term care facilities. The prevalence of pressure ulcer is crucial since it's highly costly and it forms major issue for healthcare facilities and healthcare providers. It's a problem that affects patients and their families. An increase in pressure ulcer requires advanced nurses to step in and control these problems. As you know, pressure ulcer is a localized injury to the skin. It is categorized into 6 stages. Now, I believe most of you know most of these stages. Prevention is the key. Identification of patients at risk and immediate initiation of preventive interventions are paramount to prevent these pressure ulcers. Some of the main prevention options include pressure redistributing resources, turning and repositioning, the use of pressure relieving mattresses over just regular mattresses helps to prevent the pressure ulcers. Case study. I have this 89-year-old Caucasian male with family history of aspiration pneumonia, prostate cancer, and which has metastasized to the bone, and the Braden score, which is a high risk secondary to shear, friction, activity, and poor nutritional status. Skin status, he has a stage 2 sacral pressure ulcer with mild incontinence. He's taking zinc oxide and moisture barrier, occupational therapy, speech therapy, and physical therapy. Present condition, which include back pains, severity increased with positioning, and the pain is relieved with IV morphine. Review of literature and research. Post-op patient ran pressure ulcers due to lack of nutrition, anesthesia, being in the operational room for over many hours, using a lot of medication and medical devices such as parenteral sedation, cervical collar, and others. It is noted that hospital-acquired pressure ulcer is about 14.3 to 23.9%, Evidence-based nursing practice treatment include pressure-relieving air mattress or pressure distributing devices rather than using regular mattresses. Pressure ulcer affects 3 million adults in the United States across healthcare settings, and it is most of the guidelines that is recommended include clinician using amino acid or protein supplements in pressure ulcer patients to reduce wound size. Another guideline recommended is clinician to use foam mattress or hydrocolloid dressing to reduce the wound size. And another guideline from American College of Physicians also recommend the use of electric stimulation as an adjunctive therapy in pressure ulcer to accelerate or to help out with wound healing. Support services for prevention of pressure ulcer. Reactive support services can change its load distribution properties in response to applied load. Active support services, which is capable of load distribution with or without applied load, and integrated bed system, a combination of both support system and bed frame in one unit to enable it to function separately. Study 1 here assessed incidence of pressure ulcer among 83 patients at high risk for pressure ulcer, lying in bed for 15 to 20 hours per day on an alternating pressure mattress overlay. 1.2% of the patients chose the development of pressure ulcer, while most patients report comfort satisfaction. Study 2 evaluated the impact of pressure ulcer in surgical patients with pressure relieving mattress. Incidence of hospital-acquired pressure ulcer in static mattress and power mattress were also significant, which was about 1.07 versus 0.9% respectively. Patients with pressure ulcer require pressure-reducing devices over standard or regular mattresses that are provided in the hospital. And some of other prevention guidelines include choosing an advanced static mattress or advanced static overlay over standard hospital mattress, avoiding alternative air mattresses in patients with high risk for developing pressure ulcer. The use of pressure relieving mattress or devices requires 24-hour approach. Burnout or shortage of nurses in some of the healthcare facilities affects the use of pressure relieving mattress. There is also limited education on some of these pressure relieving mattress, and it's vital for advanced registered nurses to educate the staff regarding the use of air mattress. Patients also and families are not informed or educated on devices, so it is paramount to educate them. And I know that some of these air mattresses are very costly, and most of the insurances cover it. Relevance and implication for advanced practice registered nurses. To identify risk factors for pressure ulcers and effectively use the pressure relieving mattress to ensure that patients do not develop pressure ulcer. Multidisciplinary approach, combining a healthcare professional team which will help in implementation of evidence-based solution. Other relevant implications for advanced practice registered nurses. Assessment, use of Braden scale to measure sensory perception like discomfort, skin moisture, physical activities, mobility, and nutrition. There are also comorbidities like poor nutrition, diabetes, side effects of cholesterol, cardiac, diuretic medication, old age, acute illness, congestive heart failure can result to dehydration and edema, which make the patient prone to development of pressure ulcers. Other differential diagnoses like diabetes, muscular disorders, kidney diseases places the patient at risk for development of pressure ulcers. Some are of other medication as well. So the alternative approach to help out with pressure ulcer include the use of pressure relieving mattress rather than standard hospital mattress. A Braden scale, which is one of the conceptual models that are used, was developed by Braden and Bergstrom. It shows the intensity and the duration of pressure and tissue tolerance. Extrinsic factors such as moisture, friction, and shear. Some of the internal factors, threat to the skin, metabolic demand and supply, and pressure distribution capacity. A comprehensive risk assessment is very important. Assessment of pain at specific pressure areas. Skin examination during admission is always vital. And international guidelines also advocates for regular evaluation of air mattress to ensure effectiveness and efficiency. Education of the patient and families on their decision around malfunctioning of the equipment is important as well. And this is my reference. Thank you very much for listening. Have a nice day. Bye.